Salvador Minuchin was born in 1921 in Argentina to Jewish Russian immigrants. He completed his medical degree in Argentina and joined the Israeli army as a doctor in 1948. He came to the United States in 1950, where he met Nathan Ackerman in New York and began studying psychoanalysis. Salvador Minuchin began as a child psychiatrist in the 1960s at the Wiltwyck School for Boys in New York. He and his colleagues developed a three-stage approach to the systems therapy. Minuchin's innovation was based on structure. Structural family therapy was used by Minuchin in urban slums. He believed that it reduced recidivism rate in juveniles living in the slums. And he developed the Institute for Family Counseling, which trained paraprofessionals and provided mental health services to the poor. At Wiltwyck, structural interventions were employed with families whose concerns had traditionally been treated with individual psychotherapy. Early structural interventions included accommodation, wherein the therapist joined the family system through the use of communication congruent with family interaction patterns. Sibling therapy sessions aimed directly at improving overall family function by correcting relational difficulties among the subsystem of children in the family, and co-observation with parents using a one-way mirror to expose and revise problematic parent-child interaction patterns. The point of structural family therapy is not to dispute that problems exist in individuals, or even that such problems are sometimes rooted in biological disorders. Structural family therapists do not focus on resolving an individual's problem as much as they work to change the family's organizational structure. An underlying premise of structural family therapy is that every family has a structure. Minuchin described structure as an invisible set of functional demands that organizes the way in which family members interact. According to structural family therapy, family structure includes coalitions and subsystems. Coalitions are alliances often formed within family systems. These coalitions can be healthy if it is fixed and vital for a family's functioning. However, coalitions can become harmful if the alliance is used to place blame or responsibility on a third family member. Subsystems within a family are often categorized as spousal, parental, and sibling subsystems. These systems provide different roles and functions for the family system as a whole. How the subsystem functions influences how the entire family system functions. Minuchin used boundary diagrams to observe the interactions and relationships between family members. According to structural family therapy, all family subsystems must have clear boundaries to function properly. A mapping system helps the therapist and family understand the strengths and weaknesses of their boundaries. There are three types of boundaries identified within structural family therapy. There are clear boundaries, rigid boundaries, and diffuse boundaries. Clear boundaries encourage effective communication within family members and enforce roles and habits that enhance each relationship within the system. On the boundary diagram, clear boundaries are shown by several horizontal lines. Rigid boundaries can cause emotional detachment, and create distance among family members. Rigid boundaries are often described as inflexible. The diagram represents such boundaries by the use of a solid line. Diffuse boundaries create dependence because of a lack of autonomy within the family system. Family members become fused together. This is demonstrated on the diagram by the use of a dotted line. There are 3 phases of structural family therapy. The first is joining and accommodating. This is the initial stage of therapy, which involves the formation of an alliance between the therapist and the family system. Each member is treated equally, and the therapist partners with the family by adjusting to their communication patterns and perceptions. The second phase is structural diagnosis. The middle phase of therapy involves the therapist continuously making and adjusting hypotheses based off their observations and experiences with the family. And the third phase of therapy is restructuring. This involves the therapist supporting the family by helping them to develop and maintain a healthier structure that will enhance their ability to cope with stressful situations. All right, good afternoon, guys. How is everybody? Good. Y'all doing okay? Mm-hmm. Okay, so you're Nick, right? Okay. Thorsten? Okay. Dustin? Mm-hmm. All right, and Sarah. Mm-hmm. Okay, well, I'm very glad to have you all here. So before we really get started, I really want to know what each of your perspectives are on the issue at hand. So why are we here? Dustin, would you like to begin about why we're here? No, not yet. Okay, what about Mom?
Well, Thorsten and I divorced when he was 8.
Okay.
And he's almost 10.
Okay.
And about 6 months ago, Nick and I got married.
Okay.
And Dustin just doesn't seem to be happy at all. He is disrespectful. He's, rude. He's, just wants nothing to do with him.
Okay. So what I'm hearing is that there's a new man in the house, right? And it's a little uncomfortable. Is that how you feel?
Yep.
Yeah? Okay. All right. Do you want to share what yours is?
I feel like that I am not respected.
Okay.
And I have no authority over any of the situations that come around.
Any of the situations?
Any of the situations.
Okay.
Like I don't know my place,
Okay.
where to go, what boundaries I'm able to cross.
Okay, so there's some confusion about boundaries. Okay. Do you feel like some roles are confused too?
No.
Okay, no. So what role does Nick have in your life? Nothing. You don't feel like he has any role at all? Okay. All right, so I see that you two are very close, huh? Do you feel like you have a pretty good relationship with Mom?
Yep.
All right, what about Dad? Pretty good? Yeah. So when you're at the house with Mom and Nick, do you think you should be more respectful to Nick? Or do you feel like you're pretty respectful as it is? You think you are? Yeah. Do you think your mom thinks that you are? Yeah.
He's just adjusting.
He's just adjusting. Okay. So you see how everybody's placed? You and your mom are sitting together, looks like you're a team. And then your dad and Nick are sitting next to each other. Do you think that this is how everyone should be sitting? All right, so can you redirect everybody to sit how you want them to sit? Okay, so can you tell me why you did this? I noticed you placed your dad, you and your mom on the same couch. Why do you think you did that? Because you're family. Okay, so what about Nick? Do you think that he's family? No. Nick, do you feel like you're family?
Not so much in this picture right now.
In this picture, is this an accurate picture for most days, or how do you think it normally plays out?
No, yeah, that's probably it.
Pretty accurate?
Yeah.
Okay. So what do you think should change? Do you have an idea?
We all be on the same page.
All of you on the same couch. I like that. Okay, so let's do that. What I'm going to have you do is, Mom or Sarah, if you would come sit on the couch by Nick, and then if Dad, Thorson, and Dustin could switch places. So just okay, so we have the two people who are married, so we have our marital alliance right here. We have Sarah and we have Nick. And then we have Dustin, who's in the middle. So you're connected to these two, right? And then you still have Dad. So tell me what you think about Mom and Nick's new relationship. You don't like it? Okay. Why not?
Because me and Nick don't have in common.
Okay, so you feel, does it maybe feel weird to have them in the house? Kind of like there's a stranger, maybe? You don't know him very well? Okay. So what are some things that you're interested in? Video games? So what video game do you play right now? Fortnite. Yeah, I've heard a lot about that lately. Okay, so do you think you could change your thought about you and Nick not having anything in common into something else? Do you think you can say that differently? Not really. Do you think it might work if you and Nick spent some time together, maybe focusing on something you're interested in? Okay. All right, so this is what we're going to do. We're going to do a little homework assignment, but it's going to be for the two of you, okay, mostly. So at some point during the next week, do you think y'all can find a time to meet, and maybe you can teach them a little bit about Fortnite? That sound good? Okay. Do you agree with that, Nick?
Yeah, we can do that.
There are several techniques within structural family therapy. Some of the beginning techniques involved with the initial phase of family therapy are joining and tracking. Joining is where the therapist and the family form an alliance. Tracking is a way that the therapist gathers information and makes sure that the therapist is understanding what each member of the family is saying. Then there's systemic reframing, which highlights complementary relationships. Boundary making, which is used to direct who participates in what situation and how the boundaries are set, and healthy boundaries are interrupted and altered. Then the therapist may challenge the family worldview by challenging any unproductive assumptions. Then there's unbalancing, which is used for extreme difficulties in hierarchy or distribution of power. Then we have expanding family truth, which works with family beliefs to expand functioning. Compliments, which shapes the competence by noticing small successes. Enactment, the therapist observes how the family interacts and promotes an alternative to existing patterns. And then punctuation, which enhances possibilities for new behaviors and competencies in all members. Goals of structural family therapy include structural change, clear boundaries between subsystems, clear distinction between marital and parental subsystems, effective parental hierarchy, the severing of cross-generational coalitions, changing and effective coalitions and alliances, and the development of a family structure that promotes the growth of all individuals and the family as a whole. Structural family therapy is versatile in approach and can be useful for many different types of families and family conflicts. It is sensitive to the effective culture and context on a family system. The theory focuses on the structure of roles and relationships along with the distribution of power. It can be beneficial for all types of families, whether it is a single parent home, blended, or even a grandparent as the parent. Since structural family therapy focuses on restructuring, getting rid of unhealthy coalitions or alliances, and then the redistribution of power on a custodial parent, it really can be relevant for any type of family within various types of cultures. Structural family therapy has pros and cons. One pro is that it is very versatile. Techniques have been used to work with juvenile delinquents, alcoholism, and eating disorders. It has also been effective with families in the lower socioeconomic bracket, as well as families in the high socioeconomic bracket. Another pro is its emphasis on problem solving. It is a very pragmatic theory that focuses on bringing about change. Another emphasis is the reorganization of family for symptom removal. So it doesn't just focus on the problem at hand and the specific person that the problem seems to be stemming from, but the family structure as a whole and how the entire family can function healthier in each of their roles. And then another pro is the ease of application. It has clear boundaries, clear techniques. The wording within the theory is very clear and understandable. Some of the cons include that it reinforces sexism and sexual stereotypes. Some would prefer that women are more empowered to take more effective roles within the family system. And then there is a criticism regarding the theory's ineffectiveness in looking at the history of the family to notice previous patterns or patterns that have evolved from the past into the present. And then a final con to this theory is that the therapist has most responsibility for initiating change. And so a criticism is that it doesn't fully empower family members to take on change for themselves.